I was diagnosed first 9 years ago, nearly 9 years ago, when I was 48. Diagnosed with what I was told was a cancer that affects older people. It was a little strange to me. I felt like I was some kind of exception, but but here I am. The stage was T1G3, so it was fairly, well, potentially a very aggressive tumour, which seemed to worry my doctors quite a lot. I also, later on, it was discovered that I had CIS as well, so that was an additional thing to worry about. The treatments I had for my cancer, I had a resection. I think that everybody has that, and the resection, and then I had an induction course of BCG and followed up by, I think it was 4 rounds of BCG, which started not too badly, but in the end was quite tough for me. When I started the BCG, I remember my first session being worried about it, and by the time I went home, I thought, gosh, there's nothing to this, this is fine. Just, pass the liquid out and all fine. But by the time I came to my last session of BCG, I found it very difficult to tolerate. I was one of a smaller group of patients who do find that the BCG irritates the bladder terrifically and very, very painful. The only upside was that it was relatively short-lived, so, for 12 hours after the BCG, it was pretty miserable. But, you do bounce back after that. There were times where I thought my bladder would never feel normal again. In fact, I was really quite anxious that the BCG was doing something to my bladder that it would never recover from, and no amount of reassurance from anybody made any difference to that feeling, but it did come back to normal. And, here I am 9 years later, and my bodily functions feel very normal. And that's a great relief. I'm grateful for every day that they feel like that. I was told that quite early on after diagnosis that I would be seen for the rest of my life, which sounds scary when you're first told, but actually I go every year, once a year, for a cystoscopy. I used to dread the cystoscopies because, of course, you worry they're going to find something, they're going to see something again, and you're going to go back into this great machine of worry and treatment and all that follows from that. But actually, as each year goes by, I worry less, and I don't mind going for the cystoscopies now, or if I do mind, it's not a big deal. It's good to know that people are keeping their eye on me.